The farmers' protest in India is widely regarded as one of the largest protests in human history. The farmers protested for 378 days, leaving their hometowns and made their way to the national capital of New Delhi, which was the main protesting ground. One concern that arises in a massive civil unrest movement such as this is the healthcare aspect. Who is actually responsible for providing these services to a population of protesters, especially of this magnitude? Inspired by the work of American cardiologist Dr. Swaiman Singh, who had opened up a makeshift clinic right at the heart of the protest site, me and my team decided to join him as medical volunteers and observed upfront how primary healthcare is vital during movements of civil unrest. It is a typical hot summer afternoon in the beginning of June, and we had just arrived at our destination, the Bhai Kanhaiya Singh Ji Clinic at the Tikri border near New Delhi. So appropriately named after Bhai Kanhaiya Singh, who in Sikh history is known for his exemplary service of providing medicines and water to all, even during battles, regardless of caste, creed, or religion. A typical day at the clinic usually began at 9 am. I remember there were long lines of men, women, and children on our first day, and there were people coming from hundreds of kilometers away to make use of the free medicines and the doctors there. On an average, we would see about 200 patients a day. Dr. Swaiman had also managed to set up a telemedicine clinic at the site, which was a very innovative way to connect the protesting farmers with healthcare services and specialty consultations not possible at the clinic itself. A booth outside the clinic would serve as the first stop for the patients, where their blood pressure and blood sugar would be checked. Surprisingly, these were seldom within the normal range, and it was disheartening to see the amount of unchecked hypertension and diabetes at the protest site. Most of the farmers were generally unaware about the diseases and would come in with unrelated complaints. The fact that so many people were far from home fighting for their livelihoods had a profound impact on mental health. We tried our very best to give counsel to the people who were suffering.
But the clinic was not just about handing medications to the affected. Dr. Swaiman stressed on the concept of health education, and we took time to explain to each patient about their condition and the primary prevention for these chronic diseases. This played a huge part because most of the farmers belong to a rural background, where doctors are usually not available, and all healthcare related needs are catered to by local pharmacists or indigenous medicine practitioners. To that effect, we also found that a lot of the people were mal-prescribed steroids, antibiotics and painkillers in the villages, which has led to a lot of acute exacerbations of many other diseases. Although the clinic officially ran till 5 pm, it was always open to emergencies, which were common around the protest site. Road traffic accidents, cardiac arrests, seizures presented at any time of the night, and nobody was ever sent back without treatment. The tumultuous weather with the oncoming monsoons meant windy nights filled with ferocious downpour. This was not good for the makeshift settlement set up by the protesters and led to a lot of injuries and trauma. The following days saw mornings of loading as many vehicles as possible with medicines and equipment and setting out to set up health camps at the surrounding Singhu border, where around 8,000 farmers would gather. The concept of mobile clinics at the protest site helped connect to a larger audience and made sure that healthcare was delivered where it was most needed. With curative efforts came preventative ones. Every morning at 6 am, protesters that lived around the clinic were gathered for guided yoga and stretching sessions. It turned out to be a very important part of the day, as most of the people at the protest site were elderly, and each day at the clinic we saw numerous complaints of knee pain or back pain or even shoulder pains. Simple mobility exercises were really helpful in teaching the protesting farmers to look after their own bodies and provided a refreshing start to the day. The clinic was not limited to medical practitioners. Nurses, pharmacists, and even indigenous medical practitioners found a place at the Paikanaiya Singh Ji clinic. Along with them were numerous other volunteers, some as young as 14 years old, who took care of the security, data collection, cleaning, and assistance of the clinic in every way possible. As an alternative to the allopathic care provided by the doctors at the clinic, there was a provision of a specific traditional form of healthcare called sujok. Sujok therapy is linked to Korean traditional healthcare and involves curative non-invasive solutions via variations of acupressure used at specific points on hands and feet to treat the ailments. It also makes use of seeds, semi-precious stones and magnets along with the pressure stimulation that claims to help relieve problems like diabetes and kidney stones. The clinic was not run as a one-stop solution to all issues. Protesters were free to avail services of any and all volunteering professionals.
A library, gym, and dorms had all been set up. Evenings were full of folk songs and merriment. Food was never a problem. Multiple langars had been set up all around where the protesters were living and provided healthy, nutritious, and hygienic meals 3 times a day. Social media was a powerful tool, and Dr. Swayman and his team made informative videos regarding various misconceptions that were so prevalent during the pandemic. It was also incredible to see that despite rigorous testing, there were no recorded cases of COVID-19 in and around the protest site. Multiple awareness drives were carried out regularly, and hand sanitizers and masks were distributed to the protesters on a weekly basis. It was amazing to see what had started out as a small makeshift clinic had slowly transformed into a place of refuge for so many protestants. And we were truly blessed to see the community come together due to the work of one man and his team of volunteers who embodied the true spirit of the establishment they had created. In today's world, protest movements are on the rise worldwide amid deepening inequalities and job crises worsened by the continuing coronavirus pandemic. The fundamental right to healthcare for this vulnerable population just cannot be ignored.